Okay, so I'm going to quickly be talking about a summary review article called Privacy Protection and Secondary Use of Health Data Strategies and Methods. Uh, the first thing that's made important is that healthcare data is very valuable. The main reason for this is that it's highly confidential. I can't think of a more important type of data that is the most vulnerable, essentially. It's people's information that makes them very vulnerable. Um, and so it's entrusted to clinical providers. So there's an ethical and moral obligation to protect this most important kind of data, with clinical data being considered the most important, especially electronic medical health records. And also, if you aren't keeping this data secure, then patients aren't going to continue to allow you to have it because it's their data. A secondary use of this is for research, specifically being able to make sense of that data to help move science forward and help with understanding population health and individual health interventions, etc. Which some of the benefits of that can be reduced healthcare costs, better patient care, obviously is most important, and possible directions for public health policies. This type of data being collected is increasing and will only continue to increase in the future. HIPAA is the most important legislation in the United States and also the most cited when it comes to health data. It stands for Health Insurance Portability and Accountability. It created the Safe Harbor Rule, which had 18 attributes that would it identified 18 attributes that could put data at risk of identifying the patient or would be a risk to confidentiality if those attributes weren't kept secure. So even though it provided those attributes, it defined those, it did not provide clear guidance on how to specifically implement some sort of strategy of preventing identity disclosure. So there needs to be more guidance when it comes to that, so that researchers know what information is appropriate for release. And also, specifically, there needs to be some sort of guideline for determining the risk of privacy disclosure. HITECH is another important piece of legislation that's complementary to HIPAA, expanded its reach specifically to businesses with this rule that changed when the public or people whose data was exposed in a breach needed to be notified of that. So previously, I think it was when it was more than 500 people who had sensitive data taken in a breach, and it changed so that anytime it's health data, no matter how many people it affects, there has to be notification of the breach. So there's the most important conflict going on in the debate of healthcare data is the general idea that when information is more secure, it's not as useful, or it's made not as useful, and when it is more useful, it's generally not as secure. So what resulted is a statistical parameter called the privacy loss parameter that kind of measures these two things. And the authors say this is kind of due to black and white thinking, so therefore the solution has to be a holistic one. These are going to be various methods for trying to imagine what a holistic solution will look like from the current ways of protecting data. So suppression is a commonly used type of strategy that targets those 18 categories that HIPAA defined. And then there can be more benefit of adding randomness to it after the fact, random white noise. So the main benefit of this is that it's guided by a legal framework, which is HIPAA. Drawbacks is that there's evidence to suggest it's not enough for security. And also, as data is reused each time that it's reused in another study or accessed by more people, it risks individuals being able to put those pieces together to create a clear picture of something that they're not supposed to know or see. And when you do that, when you put those things together, those things are called quasi-identifiers, the things that can be put together to discover things about the data that you shouldn't be able to, such as who a patient is, or even less specific things. So there's also the possibility that the data is not as useful, and which could even be dangerous because researchers could use that data and it could lead to results that are not accurate in their studies. Okay, so federated learning uses machine learning essentially, so a machine algorithm interacts with the data, produces a model, but that data does not need to be transported. So the main benefit of this is that it's federated, so it can stay in the place of origin where it was originally collected, and this algorithm interacts with it. So in theory, these models are more confidential than the original data, so it helps prevent what I talked about a second ago with putting together those quasi-identifiers. And the machine learning algorithm is supposed to prioritize privacy more than anything else, even usefulness of data. It's likely to maintain relevance in the future because, especially as health data regulations get more and more strict, there's a lot of things about it that that would maintain really high levels of security. But the paper doesn't address how this could affect data quality specifically, which seems really important. There's two other ways. Generalization, randomization. So generalization literally generalizes the data, putting quantifiable measurements in a more into abstractions, and the amount needed is dependent on an equation. Randomization replaces information. It literally randomizes. It replaces information with randomized information. So this method can actually reduce data quality, according to the authors. Synthesization is the best of both worlds in that it maintains both security and the quality of the data. So it works by having statistical tests and measurements interact with the data, and then from those is produced a new set of data that can mirror the original. So there's never a need for the original data outside of the processing of it, the initial processing of it, and it could allow processing of even the most sensitive data, such as clinical data and EMR data. So that's could be really big going forward. And so apparently this set that mirrors the original is as good to use in research as the original. No drawbacks mentioned. Data mining divides the roles up until people only do what is needed. So roles are divided, and then from those roles, tasks or tasks that need to be performed are divided. The drawback of this, though, is the data quality isn't as good. Genomic data is treated differently. So, for example, I2, B2, an open source tool, allows researchers to access data, which they can access clinical data if it's de-identified, but for genomic data, it has to be IRB board approved. And there aren't any specific protection mechanisms, so that's probably why there's kind of more strict requirements for that. The two threats are either unauthorized access or illegitimate access. So these guys proposed an architecture for dealing with genomic data that utilizes homomorphic encryption, or being able to keep data in its encrypted form as much as possible and interacting with it, and differential privacy, which is, being able to explain group results without revealing individual things that led to those results. So this is the architecture. I don't really have time to go into it, but basically there's separate clinical data network, researcher network that information is transferred to from the clinical data network. I2B2 server is hosted by the researcher network, which then hosts a proxy server. That is how the researchers actually access the I2B2 server. So it's basically like a big filtration system. So some unanswered questions is if data can really be, if the usefulness of data can really go down as security goes up, like the authors say, there's not really a lot of information to support this or show it. And also, it would be important to know kind of the dangers that exist with scrubbing or manipulating data in terms of like incorrect conclusions being drawn to it. So it would be interesting to explore that risk. These technologies are really interesting, and some of them are quite complex, to me at least, and new, novel. So it would be interesting to see how they work in detail, which this paper didn't go into. So the paper was published in 2021, and the genomic data model was apparently implemented into a real world setting. So it'd be interesting to see the results of that. So there's a lot of opportunities for this, and that's about it.